Thank you, Deputy Speaker. I rise to talk on the suite of aged care bills and the amendment. Deputy Speaker, Australia is in the process of change. We are undergoing a significant transformation as we experience an ageing of our nation's population. Australians are living longer than ever before, and subtly yet surely this shift will define the lives of the next generations of our country. We can expect that a fifth of our population will be over 70 years of age by 2051. Our country will have to contend with challenges such as a shrinking of our tax base from 6 workers for every retiree to 3.2 workers for every retiree by 2047. We'll be facing an extraordinary increase in the reliance on health services and a far greater demand on aged care services. Deputy Speaker, it is critical that as policymakers we are preparing for our nation's future in every way, but specifically how to face the challenges of an ageing population. It is critical that we have a separate debate about the best possible ways to approach the changes that we will inevitably face and how this can be managed while keeping our nation's economy strong. Deputy Speaker, this week we will see two very clear, distinctive alternative plans for our nation's future. We will see a government in chaos and confusion, a government that is scrambling at the last minute to redo their homework sums before the deadline. But in contrast, we will see a strong, united coalition team that is prepared and willing and able to lead this country into a better and brighter future. A team that has a strong vision for Australia and has the practical plans to ensure that we get there. These two integral differences, the two choices that Australians will make this year, Mr Deputy Speaker, are illustrated in this debate about aged care. The Aged Care Living Longer, Living Better Bill 2013 and related bills are a ramshackled package offered by this government. They have failed to address the key industry concerns and the challenges of addressing real reform for our seniors. Deputy Speaker, this is a wasted opportunity for us to have an appropriate and real reform in this sector that will provide stability for the years to come. This package of bills fails miserably to do just this. The aged care sector, in which I've been consulting within my own electorate and broader, has faced 5 years of neglect from those opposite, and now definitive action is needed to ensure that aged care services are providing effective care for older Australians. Debate on this package of bills is rushed. My question to the minister is, why the rush? This government has spent over a year sitting on its hands after announcing its aged care plans, but they have failed to bring any legislation before the parliament. The minister is now attempting to rush through this legislation. The minister has brought forward the reporting date for the Senate Community Affairs inquiry, reducing the amount of scrutiny and consideration given to this legislation that will amount to significant fundamental changes to the aged care sector. Already from the Senate inquiry, we know that the department is unable to answer many of the questions raised in these bills, and that instead the minister's department has advised that the detail would not be released until these bills were passed by the parliament. Deputy Speaker, why is this government so determined to avoid proper scrutiny of the finer detail of this legislation? Why is it so determined to push through the parliament without adequate time for consultation? This is a particularly pertinent question, Deputy Speaker, as most of the legislation does not come into force until July 2014, and that which comes into force in July this year can be dealt with within existing legislation. Deputy Speaker, as I said earlier, this is a policy area that requires significant reform, but it cannot be done on the run. It needs time to ensure that the changes will benefit the sector and the older Australians it cares for. With such an emphasis being placed on aged care services in the coming years, it is vital that we make well-informed, sound judgment to avoid ad hoc band-aid patch-ups later. Might I also refer to a couple of comments from the Leading Age aged care group. Every 71 minutes, another older Australian is denied the care they need. 90 million is the recurrent shortfall between income and the real cost of care for those in residential facilities, and 63,000 new beds are needed to be built in the next 9 years at an estimated $17 billion to cater for those emerging needs of the elderly. Excuse me. The Productivity Commission's report recommended a shift from the current ratio system of aged care licences to a system where aged care would become part of the health system. It was clear that the amount of red tape and regulation faced by the sector needed to be reduced. Additionally, the Productivity Report recommended the creation of a single Australian Seniors Gateway Agency, that funding be replaced by a single national care coordination regime which would apply across the aged care system, whether services are delivered in the community or in a residential aged care facility, greater transparency of care prices, and a range of capital funding options and contributions for accommodation costs. This package is another example of Labor's spin at its best. Deputy Speaker, when the government announced this package, it tried to have us believe that it was putting an additional $3.7 billion towards aged care funding. Unfortunately, the figure for the new funding was closer to $577 million, a small portion of what was promised and what is being called for by the sector itself. This government is attempting to pass off cost-cutting measures and funds shifting as new spending. The most disappointing result of this is that this legislation acts more as a smoke and mirrors measure rather than a true problem-solving policy direction. This package of bills does not resolve the viability issues for aged care service providers. Deputy Speaker, this package of legislation affects changes in 4 key areas: residential care, home care, governance and administration, and the administrative and consequential charges. The bills will mean that those who enter residential care from 1 July 2014 will face a new means test calculator combining income and assets tests. There will also be new and annual lifetime caps on mean-tested care fees under this plan. Under these bills, those in home care situations will face changes to the way that home care subsidies and fees are calculated. Many care recipients will be required to contribute more to the cost of their care under the income-tested care fees. New annual and lifetime caps will also apply to income-tested care fees. Additionally, a new aged care pricing commissioner will be established to make decisions on pricing issues. These bills would add even more regulation to an already overburdened sector, Deputy Speaker. The biggest failing of this package is its failure to address the already over-regulated nature of the sector. The current structure of aged care industry already flags some serious concerns about the ongoing viability of service provision. This is an issue that providers have been extremely vocal about, and it was assumed that with a major reform of the sector it would be one of the fundamental points addressed by the government. Unfortunately, the minister has glossed over this concern and has even gone so far as to introduce new measures of red tape, which will make it even more difficult for service providers. Up to 89% of aged care facilities are set to face unrecoverable losses of revenue under these changes. Anecdotal evidence suggests that aged care nurses are spending a third of their time filling out paperwork. This is an incredible regulatory burden that is directly detracting from their ability to provide care to patients. This legislation increases the red tape, which will result in even less time for nurses, patient care and much more time spent on paperwork. Service providers in my own electorate have contacted me regarding these bills to express their deep concerns about the implications for the industry. Already we are aware that 60% of aged care facilities are operating in the red due to the increasing compliance demands of government. Providers are handing back their licences and walking away from the sector because aged care service provision is simply no longer viable. Under these changes, Deputy Speaker, as revealed by the Senate inquiry, aged care facilities with less than 60 beds will be so severely impacted that they will be forced to either shut down or amalgamate with other facilities. Even those with more than 60 beds will be under increased pressure with less funds for patient care. Take this example from a service provider who has stated that under the changes they will receive $31.92 less for a patient each day, amounting to $222 less a week. Couple this with increasing wages and it becomes very difficult for a service provider to continue to provide the same level of optimum care to patients. While we are already calling out for additional aged care beds, the last thing that we can afford to be causing through policy implementation is a further shortage of aged care beds. Change in demand for aged care. Deputy Speaker, senior Australians are finding it more and more difficult to obtain places in aged care facilities. Not only this, but they are finding it more difficult to access the services they require in the context that they desire. There is a pervading opinion held by both older Australians and health professions, supported by the growing body of evidence, that the aged care sector is unable to adequately provide for the complex needs of Australians. This is adding momentum to a growing trend that Australians want to spend longer in their own homes, receiving care while remaining in their own homes. The fear that more Australians are having about being able to access aged care services should be of serious concern to the government, who is simply not doing enough to address these concerns under this legislation. The government has not listened to what the sector has been calling for. Despite its protestations, this government has not undertaken appropriate consultation with industry to determine what is needed. This government instead is attempting to ride roughshod over the industry and force changes that are not practical. We are aware that the proposals that the government provided to industry were rejected by providers, and we know that rather than true reform, there is no more than a move to unionise the aged care sector. Another particular concerning factor about the way that this legislation has been shaped and the compliance that is intended to be thrust upon the aged care service providers is the way that it is seeking to underhandedly increase the union presence in this sector. These bills will mandate a workforce compact, and this work compact is not supported by the aged care providers, and will force them into enterprise bargaining agreements that will effectively subsidise union membership in the industry. The workforce supplement will see aged care providers with 50 or more beds required to enter into enterprise bargaining agreements simply to access funding. This is no less than a blatant attempt to increase union interference under the guise of legislative reform. Further, Deputy Speaker, the Minister has cut $1.6 billion last year from the aged care funding instrument in order to finance this $1.2 billion workforce compact. In the words of one of my local aged care service providers, it is taking funds from direct care and placing it into a pool set aside for wage increases without allowing anything to go to on-costs. Furthermore, it is totally unaffordable because of every dollar received, the employer has to find another $2 on top of whatever we have committed in our EBAs. Deputy Speaker, this legislation is taking money out of the service provision and redirecting it to union dues. This is not a good outcome for thousands of older Australians whose care will be jeopardised through the loss of funding from services. Deputy Speaker, it is the thousands of Australians who will be adversely affected through these changes that we need to be making the right decisions for. This is our opportunity to have reform of the aged care done well, in a way that assists providers to provide the best quality of care to Australians in the context that they wish to receive care. These bills simply do not have the detail about what these changes will be, and they are a very short-sighted attitude from those opposite who are trying to push through these changes without seeing the outcome of a Senate inquiry into what the implications will be for the industry itself. Thank you, Deputy Speaker.